protected by advertising outside the UK.
Hello, I'm Dr. Michael Mosley and welcome to my new BBC Radio 4 podcast series, Stay Young. In each episode, I'll explore one simple, scientifically proven thing you can do to rejuvenate yourself from the inside out. Which will you try? Maybe a slice of mango to reduce your wrinkles.
Delicious.
Or learning something new to stay sharp.
Hi, okay.
How about lifting some weights to protect your muscles against the ravages of time?
That was quite tough.
To hear all about how to stay young, subscribe to the series wherever you get your podcasts.
Hello there and welcome to the Inside Health podcast. I'm James Gallagher and we're going to be exploring heart attacks in women today. So a simple question for you. Would you recognise the signs?
Very, very lightheaded, a bit disorientated, pain in my back, pain in my legs as well. I've noticed a bit of swelling, like I was holding water. But on the day, there was no clutching of the chest. It was backache and down my left side arm.
Dawn didn't know she was having a heart attack and had dismissed it as anxiety. Now, I've got an interesting question for you. What do you think would have happened if a man had had exactly the same symptoms as Dawn? And it's one to ponder, isn't it? Well, the British Heart Foundation says women take longer to seek help, and when they do, they're more likely to get the wrong diagnosis, at least initially. So we're going to unpick this today, what's going on, and we're going to hear from Dawn again in a minute. But first, here's our regular cardiologist and YouTuber, Dr. Rohan Francis.
I'm in the emergency department of my hospital, where my colleagues and I seem to spend a lot of our time these days. And as presenting problems go, heart attacks continue to be tremendously popular. The last few years have also seen an increase in the concerning phenomenon of problems accessing cardiac care, first from the pandemic and now NHS pressure. One case, a young woman in her 40s, has really stuck with me because I know that I would have treated her differently just a few years ago. She came in with a big heart attack. We took her to the cardiac catheter laboratory, like our operating theatre, and she had a nasty-looking narrowing in a major artery supplying her heart. When I was a very junior doctor, I recall a similar case. A woman of around 40 came in with chest pain, an abnormal heart racing, and abnormal blood tests, a full house of things to diagnose a heart attack. My boss at the time put a stent in, which is the little metal mesh tube we implant to keep arteries open, but she already had 3 stents from 2 previous admissions. So why was such a young woman repeatedly having heart attacks? Her problem actually wasn't the usual cholesterol plaque narrowing of arteries, which is a conventional mechanism for a heart attack. She had something called spontaneous dissection of the coronary arteries, where the lining of the artery tears. Over 90% of patients who develop this are women. My colleagues and I are very familiar with this now, so for my patient this week, I knew that the most appropriate treatment was not to put a stent in, but to let the tear heal and avoid putting metalwork in a young patient. And it made me ponder how much our understanding of women's heart disease has changed in just my 10 years as a cardiologist. We know that while most people have the typical crushing chest pain that we all think of as representing a heart attack, women are much more likely than men to have atypical symptoms, a sore arm, back pain, neck pain, or something perhaps even more vague like dizziness. As our knowledge has increased, so has the accuracy of our diagnostic tests, meaning that we're catching much more of these cases, but how many women in the past might have had their heart attacks missed? Popular culture has tended to depict heart disease as something that predominantly affects men. Stressed out stockbrokers or HGV drivers, cigarette hanging from their mouths. But because of this, some women might feel that it isn't something that tends to affect them. While it's true that men develop heart disease earlier than women on the whole, in terms of absolute numbers of new cases, it's quite comparable between the sexes. And only recently have more resources been put into actually undertaking research that doesn't predominantly focus on men. It's always valuable to be reminded that in medicine you can never adopt a one-size-fits-all approach. Instead, you have to be aware of how men and women can differ, and how every patient is an individual who hasn't necessarily read the textbook when it comes to how their heart problem manifests.
Interesting there from Rohin, isn't it? How perceptions are starting to change. Well, let's hear more from Dawn, who we heard from right at the beginning. She lives in Newcastle and she survived a heart attack. Hi, Dawn.
Hi, James. Thank you for having me.
No, pleasure. How are you feeling at the moment?
A lot better than I did 2 years ago.
Good. Walk me through what happened. When did you first know something was going wrong?
I was just feeling very lethargic. I didn't have any energy. And I thought it was a bit to do with anxiety and depression because I had a lot going on at the time. And it was just before Christmas. I was doing the Christmas shopping and a lot of backache, a lot of armache, and you just think it's through carrying shopping. And it all turned out I was actually having a heart attack. Feels like a volcano. The build-up of the stress is the end of the heart attack. I get rushed into hospital from my doctors. I'm working a 47% heart at the moment.
Crikey, that's quite something.
Yeah, so I've just got a little less energy than everybody else.
But you didn't think you were having a heart attack?
That's the thing. It felt like more of an anxiety attack.
And had you had anxiety attacks before?
Yes, and it's the same symptoms. Tightening of the chest, it's losing control, lightheadedness. So they're very, very similar. A lot of my pain came in my back and down my arm. But we'd carried all the Christmas shopping back. So you expect to be aching.
Dawn, it must have been quite something that the moment doctors told you that it was a heart attack.
It was. I was 46 at the time. They said I was very lucky and that a lot of women, we put our kids first, we put husbands first. You tend to put yourself last. So the last thing I needed was going to the doctor.
Okay, so how long was it, Dawn, between those first symptoms you had and you actually finding out it was a heart attack?
It was about 6 days. I went to my doctor's in Monkseaton and straight away they took my blood pressure and straight in an ambulance from them.
And just so I'm clear, you said after dinner, that was Christmas dinner, wasn't it?
Yeah. I have to cook Christmas dinner.
You powered through a heart attack to cook Christmas dinner.
Yeah.
I hope you have like a super mum mug somewhere at home. And even then, that doesn't do it justice.
It's just I knew it had to be done.
6 days, cooked Christmas dinner in the middle of it, looked after the family, and then got diagnosed with a heart attack and ended up in the ambulance. It's quite something. Yeah. How much treatment did you need in hospital? What did they have to do?
I had 3 heart surgeries within the year.
Oof, a lot.
It's always amazing what they do. It's amazing. They went through my left arm first and they go down your vein. So you're only left with like a tiny scratch. So they tried releasing the blockage. It had solidified, so they couldn't do it the first time. If it were detected earlier, maybe it wouldn't have been solidified. So the next time I had 2 surgeons, one on each arm, so it was like being crucified. They couldn't release the blockage again, so it was the 3rd time, lucky for me, that they released the blockage and put 2 stents in. She was a lovely lady, the surgeon, but it has caused damage to my heart. I'm getting old anyway. I'm a grandma now.
A young one? Come on. Let's not call our 40s old, right? And has it been quite a lot of recovery time after that operation?
Yeah. I don't think it's a shock of finding everything out as well, isn't it?
Yeah. So, Dawn, what's day-to-day life like after having a heart attack? Is everything back to normal or is life different now?
Well, it's different because you're more careful. Like I give up drinking, cutting down smoking with an aim to give up smoking. I'm on about 8 tablets a day. I think you like life a bit more because you've had that scare.
Well, I'm glad the surgeries all went really well for you, Dawn, and that you're kind of as good as you can be at the moment.
Yeah. I'm getting a tiny bit of energy back. But yeah, it's an eye-opener. Thank you to all the hospital staff as well, from Cramlington to the Freeman. Yeah, lovely people.
Well, Dawn, I hope somebody listening to this goes, okay, those are the symptoms of a heart attack. I need to be aware of those.
Yeah. And, it's always best to get checked out. Better safe than sorry.
I think we need to agree, and you need to tell one of your family members that it's on you next Christmas, okay? See the sofa? I'll be there the whole time. I'm putting my feet up. Somebody else is sorting it out.
I did miss you.
Dawn, everybody here at Inside Health wishes you all the best for the future. And I do want to stress that while Dawn didn't have chest pain, it is still the classic and most common symptom of a heart attack, and that's regardless of whether you're a man or a woman. And we're going to get into that a little bit with Vijay Kanadian, who's a professor of interventional cardiology at the Freeman Hospital in Newcastle. Vijay treated Dawn and also researches the gender gap in heart attacks. So Vijay, welcome to Inside Health.
Thank you very much for having me. My pleasure to be here.
So, how common is an experience like Dawn's?
It's not uncommon because I think women put their family first, which I think is what Dawn told me because it's Christmas time.
Power through Christmas.
And she powered through Christmas. Or maybe women refute the symptoms. Or just simple indigestion. Maybe I pull my muscle. Could this be heart? Is not on the top of the list of things that crosses a women's mind, for example.
I was wondering about this because kind of like almost every time you think of a heart attack, this is probably hugely sexist, but embedded everywhere.
Yes.
Frequently think of a man first.
Yeah. But when you look at our own UK statistics that's come through from ONS, it classifies cardiovascular disease as a leading cause of mortality, in particular coronary artery disease. When you take heart, for example, you have valves, you have other structures, but the coronary artery disease is the lead cause of mortality for women.
All those blood vessels that feed and nourish the heart itself.
That's right, yes. And it's not breast cancer, it's not cervical cancer, it's heart disease. And even when we are in 2023, this message is not really obvious, both to our patients and I'm also shocked to say among our clinicians.
I was curious about that. Is it women don't expect that they are having a heart attack, or is it when you get to the hospital that the doctor goes, no, it's not a heart attack?
Both, yeah. So when a woman is experiencing symptoms in the community and she thinks it's not my heart, and you have a perfect example in Dawn. I, in fact, have another patient who was experiencing full-blown heart attack, and she approached the GP, and because she was a heavy smoker, she had some noise in her chest, and GP prescribed an antibiotic and sent her home. And of course, the symptoms didn't get better, and she went back again and she got prescribed indigestion tablets. So third time around, and the sister looked at her, you're not looking right, and the ambulance arrived and do the ECG, and of course, it's full-blown heart attack.
Is she okay now?
She's okay now,
okay.
Yes. She was very lucky. Again, both Dawn and my other patient, who's very happy for me to share her story, they didn't think it was a heart attack.
So, Vijay, obviously there are some physiological differences between men and women.
Yeah.
Are heart attacks the same in men and women? That almost sounds like a stupid question.
No. It's a great question, actually. When there is a full-blown heart attack, there's a buildup of lipids or cholesterol within the wall of the artery, and that ruptures and gives rise to the common forms of heart attack. The artery blocks off suddenly 100%. When that happens, you have to get into the hospital as quick as possible. But women have a higher prevalence of what we call as myocardial infarction with non-obstructive coronary disease.
Okay, so when you're in those coronary arteries that are nourishing the heart, they have more of the ones that don't completely block the blood vessel.
And women have some unique conditions. Things like spontaneous coronary artery dissection, i.e. tear, but women have a tendency to rupture it without any obvious reason.
Do we know why there's that difference?
When a woman is pregnant, it's a stressor. Say a woman has a child in the late 20s, and she got diagnosed with blood pressure during pregnancy or a little bit of elevated glucose. The baby is born and the whole thing gets forgotten. And there are studies which suggest when you have gestational blood pressure, gestational diabetes, then you're 7 to 10-fold higher risk of having further
real,
heart attacks for real down the line. Women, when she experiences that, she never gets to see a cardiologist. So she doesn't get put on the right treatment, say aspirin or statins or blood pressure treatment. And then that leads to higher rate of events. And again, this is something that I have found in my own study. The prevalence of heart attacks in younger women is on the rise. Maybe it was always there, and we are having a lot more new diagnostic tools that are available to diagnose this. And the other thing, again, menopause happens around 50 and the estrogen drops significantly. Estrogen has got a protective effect on the wall of the heart arteries, brain arteries, or leg arteries. So once the estrogen levels comes to baseline, we see an increase in the prevalence of heart disease. So a lot of physiological mechanisms that are very different in women compared to men.
Well, let's just be clear, Vijay. What are the symptoms in women? When should you seek help?
Yeah. So majority of the patients, they experience chest pain, pressure across the chest.
And just to add to that, Vijay, like Dawn had, her main symptom was back pain. Because she thought it was from carrying too much shopping.
Yeah, it could, range of symptoms, arm pain, neck pain, back pain. Some people just describe, I only had pain on my left side of my face. The nervous connection to the heart is the same as the rest of the arm or neck, so people can feel discomfort anywhere. If that doesn't go away within, say, 10, 15 minutes, and they feel they're not able to carry on with their daily activities. Also, on a pain score of 0 to 10, if it's 8 or 9, then without a doubt, they should ring 999 directly. Some people, they might have a mild aversion. So maybe that's when you ring the other numbers that NHS provides or even contact the GP.
It sounds like there must be a consequence to all of this, Vijay. Are more women dying because of this?
Yeah, that's the shocking bit. So we have a myocardial infarction national audit project called MINAP. So every patient that comes into the hospital with a heart attack, for example, gets recorded. At the moment, we only have it for England and Wales. My colleagues from the MINAP database, they analysed the difference between men and women. And they showed that women have higher mortality when they come in with the diagnosis of a heart attack. And I looked at 500,000 patients, both using the British Intervention Society database. I also compared with the Swedish data. And both data showed that women have higher death rate, both in hospital and down the line following a heart attack. And we must stop that from happening because heart disease is a preventable condition.
How much bigger is the risk of dying?
Actually, the analysis that I have recently done, looking at the north of England, 50% higher risk of 50%. Odds, 50% odds of having a mortality. Maybe if they survive the initial admission, perhaps they get put on the right treatment, the mortality decreases.
And that's, is that from either getting to hospital later after more damage is being done or not being picked up in hospital?
Yeah. Once you have a heart attack and if you leave longer before you get help, opening the artery, the heart muscle can actually suffer. So people end up with heart failure. And women, when we do the procedure, they're at slightly higher risk of complications happening. Then their outcomes can be bad. And the most commonly recurring theme, women are underprescribed with the guideline recommended medical therapy, even the basic drugs like aspirin.
Like statins.
Aspirin, statins, ACE inhibitors, these are life-saving drugs. And we know that these drugs work equally for both men and women. And I actually did a study where we made sure that we gave the same treatment, then the outcomes are actually equal. And it's a small study, 300 patients, but there you have the answer. This is why I go when I'm giving lectures and say management of heart disease is not rocket science, but it's making sure that women are receiving those
actually
implementing it, and also for them to take it. One thing I'm not sure is whether women have lower compliance with medical therapy. That's something that I have not looked into. But the prescription rate in itself is so much lower. And again, I found that in my own study, which we presented as an abstract. Hopefully we will get that published in the coming weeks or months.
How do you balance this out between everybody ending up in hospital all the time, being checked for a potential heart attack? Because so many of those things happen all the time, versus the position we're in at the moment where too few people are seeking help.
We need to draw a balance, without inundating and constantly people are worried, is this my heart? But if people have risk factors, high blood pressure, diabetes. If they have a family history, and I see that a lot in the north of England, they say, I don't smoke, I don't have high blood pressure. How did I get my heart attack, doctor? If you go into the history, somebody in their family died at the age of 40. So if you have these higher risk factors, then I think such patients should have a low threshold
be much
to
more
seek
alert
help.
to
Much more alert to symptoms. I mean, if you look at Dawn, I don't think she would mind me saying that. She was a heavy smoker. And that puts her at a higher risk of developing coronary disease. My patient, Dawn, whom you have interviewed, she had a completely blocked artery and she ignored her symptoms. I don't know whether she has a higher threshold for pain tolerance.
I think we just called Dawn Superwoman or something.
Superwoman or something. But I don't want people to be superwomen. We want them to come to hospital.
Thank you to Professor Vijay Kanadian, Dawn and Dr. Rohin Francis for helping us illuminate the issue of heart attacks in women. Now, moving on a little bit, because I've got a pile of printed off emails because I love getting them in from you. And these were all about our programme on medicinal maggots being used to clean up nasty wounds. And some of them are really interesting. So I like this one from my uncle was treated with maggots on his open wounds in World War II. They healed his open sores wonderfully. That really tells you how old this idea is. Another cracker here from someone who worked as a geriatric nurse in the 60s and 70s who regularly used medicinal maggots on gangrenous wounds such as frostbite on the ears and toes. Prince Harry, I hope you're listening. They said they worked brilliantly and prevented lots of amputations. It's a great shame they were stopped and replaced with antibiotics. And Iris emailed in as well. She studied these when she was at school in Germany. Loves a bit of maggots. Totally not freaked or squeamish about the programme, so you did better than I did. And here we go. What's not to like? They'd be the first treatment option for me. So I think we've got a convert in Iris there. Now, if you want to get in touch, insidehealth@bbc.co.uk is the email address, or you can tweet me at James T. Gallagher. And if you've got no idea what we're going on about and you missed the magic of maggots, well, go subscribe on BBC Sounds. It's all there, the entire archive. I don't think I've told you this before, but when I turned 30, I decided I was going to learn to play a musical instrument. It was going to be my big challenge through my 30s. And I signed up for group piano classes. And that was all going quite well until the pandemic completely put those to a halt for 3 years. So if what you're about to hear is a little rough around the edges, you'll have to forgive me. That wasn't a total car crash. That was a miracle. I'm very happy with that. That was one of my grade 1 piano pieces. And curiously, it came up in a piece of scientific research that was exploring how learning to play piano changed the brain. And I wanted to find out more.
I'm Dr. Karin Petrini. I'm a senior lecturer at the Department of Psychology in University of Bath.
Karen, welcome to Inside Health.
Thank you. Very excited to be here.
So I suppose the first question, Karen, is why have I been practicing my piano? I thought I'd been done with grade 1 a long time ago.
Well, based on our study, it looks like it's never too late to gain from playing the piano. And so we saw that even 1 hour a week can make a difference in some cognitive abilities as well as in some measure of depression, anxiety and stress.
So Karen, over the course of those 11 weeks, what differences did you start to notice in the people that were playing piano?
And so what we noticed is that the participants that learned to play the piano show enhanced or improved abilities to detect the desynchronization between sound and visual information. And this was true for very simple event or for more complex event like a person talking or pronouncing a letter.
Why is that important, the way in which the brain is processing sound and sight at the same time?
Yeah, it's very important. We do that seemingly with no effort, but actually our brain works really hard to make sense of all the information that we receive all the time. If we have a confirmation of something happening from both seeing something and hearing something, or sometimes even touching something, clearly we are making better informed decisions when we do different tasks.
So is that like when I'm crossing the road and that would be kind of like, can I see any cars coming? Can I hear anything coming? Is that the kind of information we're talking about?
Exactly, because think about it. If the brain was putting together the visual information that is from the car approaching with the sound of a different car, you start making dangerous mistakes.
And I'm guessing just watching television.
Exactly. Sometimes you can very easily detect whether there is desynchronization between what you see and what you hear. But clearly, you might just feel it's not a very good TV program. You might not enjoy it very much.
Absolutely. And Karen, how big a difference did you notice after 11 weeks? Is it something that would be meaningful in people's day-to-day lives?
Yeah, it would be, because an improvement of 50 milliseconds after a few weeks is huge. Actually, it might make a huge difference when you interact with other people to understand how they are feeling in the moment by looking at the facial expression together with the voice. Then you will be more able to make sense of whether your friend is happy or sad in the moment.
Do we understand what it is that is leading to these changes? Is it just playing the piano specifically, or would any musical instruments do the same thing? Or is it something about actually spending time having one-to-one lessons and classes?
It's difficult to say exactly, but with our study, because we compare them to a group that listen to the same music, and we show that this improvement was only for those that played the piano. However, I don't expect the piano to be special. I would expect a similar improvement with playing the drums, for example. And you can imagine why, because for the drums, it's so important to keep time.
This is quite a small study, Karen, only a few dozen people involved. So how much can we conclude about whether we should all just go take up a musical instrument?
So yeah, I agree, small because we were limited by the pandemic, but because our results are in agreement with a lot of previous studies, I'm quite confident that it will be really good to start playing that instrument that is just in your garage at the moment again. For other measures like improvement in depression, anxiety and stress, then I'm less confident, because there is still not enough evidence to say that actually playing an instrument rather than just listening to music might benefit more depression, anxiety and stress. We definitely need a bigger study.
Are there any people who might benefit more than others from something like this? I'm just wondering, say in the elderly when the brains don't perform as well as they do in our youth, or say in people with autism or other conditions where it affects the way the brain processes information.
Yeah, absolutely. So we didn't look at older adults, which will be super interesting. What we looked at is whether people from the general population with higher number of autistic traits could benefit more. And we have a preliminary evidence that that might be the case.
So should I keep practicing, Karen?
Of course, always. I mean, I am practicing and I'm pretty sure that you are really good. I'm terrible.
I'm really not.
But I love the drums. It's my passion in a way. And so the fact of being terrible will not stop me. Because as our study shows, it's never too late.
Dr. Karen Petrini there. I suppose I really should get practicing again. But thank you for listening to this edition of the Inside Health podcast with me, James Gallagher. The producer was Paula McGrath and the studio manager was Sarah Hockley. All that's left is for me to be incredibly self-indulgent and play myself out.
Hello, I'm Dr. Michael Mosley and welcome to my new BBC Radio 4 podcast series, Stay Young. In each episode, I'll explore one simple, scientifically proven thing you can do to rejuvenate yourself from the inside out. Which will you try? Maybe a slice of mango to reduce your wrinkles.
Delicious.
Or learning something new to stay sharp.
Hi, okay.
How about lifting some weights to protect your muscles against the ravages of time?
That was quite tough.
To hear all about how to stay young, subscribe to the series wherever you get your podcasts.